Welcome, everyone, to the Clackamas County Board of Commissioners Issues and Updates, July 30, 2024. Administrator Gary Schmidt, you are up.
Thank you, Chair Smith. All commissioners are present. We're going to jump forward in the agenda for the measles outbreak update to respect the time of our doctor. So to present this update will be so Dr. Sarah Present, our county's medical director, and Kim LaCroix, our deputy public health director. I sent you an email last week, and this will be a verbal update. Go ahead, please. Dr. Present and Kim.
Thank you. Is this on?
Yes.
Yeah, okay, great.
Welcome.
Hi.
Please introduce yourselves.
Yes, good morning. Thank you, Chair. Thank you, Commissioners. I'm Dr. Sarah Present. I'm the Public Health Officer for Clackamas County, and I'm here with...
Hi, good morning. My name is Kim LaCroix. I'm the Deputy Public Health Director.
Go ahead. Thank you.
Thank you. So we presented a few weeks ago around a multi-jurisdictional measles outbreak in Oregon that began around June 14th. There was some increased media this weekend around the ongoing cases, and I wanted to give you guys an update about it. So as of today, we have 19 cases of measles confirmed in Oregon this year. That's up from the 5 at early June when I last spoke with you. Of those 7 are Clackamas County residents. You may see on the news a number of 5. We don't have 2 new cases, but a clarification on the addresses that happened just over the weekend. So there are actually 7 cases confirmed in Clackamas County. 3 people of these 19 have been hospitalized. Luckily, no deaths, and there are still some suspected cases that are under investigation. So, bottom line, we have ongoing measles transmission in the state of Oregon. A couple of cases have been travel-related, but the majority of them are being transmitted within Oregon, primarily in Marion County and southern Clackamas County. People are at risk. Clackamas County is currently monitoring 13 individuals who have been exposed and who are at risk of getting measles from their exposures. When we monitor them, we try to watch out for any potential symptoms and help ensure that they can seek medical care if they need to in a safe manner that doesn't expose other people. So one thing that I would like to ask the public and really get out there for medical providers and for people who may have been exposed and have symptoms, if you're seeking medical care, to really call ahead of time and make sure that they know that you're concerned about measles so that there's not a waiting room exposures, right? So people can wait outside in the cars before potentially being brought in to be safely seen for medical care they need. That's a basic overview. I'm happy to take any questions that you have. We have lots of information.
Do you have any comments, Ms. LaCroix?
Well, I was going to provide just an update on operationally, how we're managing that. Would you like to hear that? Just operationally, like some of the staffing and things that we're doing. Okay, so we're working very closely with the Oregon Health Authority and with Marion County on information, sharing resources, messaging. Like Dr. Present said, we're working with providers to make sure they're on the alert for suspect measles cases, that they're doing the right types of testing. Our communicable disease team is doing the case investigation and monitoring of contacts. And I'm really proud of our community liaison, who's really been working closely within the impacted community with trusted community members, community organizations, to get the information out in culturally appropriate and linguistically appropriate manners. They've been able to get information out through social media and through messaging apps. And I just wanted to recognize a lot of the public health staff that are working really hard. Of course, Dr. Present, but also our nursing supervisor, communicable disease nurses, community liaison, and our immunization coordinator. So.
Thank you very much. We have some commissioners with questions. Commissioner West, you're up.
You may have already said this. I'm not sure if I caught it. How many of our cases are actually being hospitalized? I know it's a common occurrence that individuals must be hospitalized, and how many are hospitalized?
Yeah, so of the 19 cases in Oregon, 3 of them have been hospitalized. Many are being diagnosed in emergency room type settings, so they are seeking some short-term care without being admitted. The CDC this morning, their website said that of the 188 cases in the country, 49% have been hospitalized, but I don't know the details of that.
And also, CDC is, it looks like this is unusual a little bit, what we're seeing across the country. We've had, 3 or 4 outbreaks An outbreak is when you have so many people that contract the virus or the pathogen. But we've had, 14 or something, or 14 or maybe more than that outbreaks nationally. So we've seen a big spike in a measles outbreak. I guess more specifically than outreach, what are we actually doing to try to get ahead of this, to stop the spread within vulnerable populations that tend to maybe see measles happen in their communities? And so I know that it's not necessarily every population with our county is at risk, but I am concerned about how do we get those vaccination rates up and what we're doing to help people get there. And is there any requirement going into the school year? We're going to be doing back to school pretty soon. Are we preparing for that?
Yeah, thank you. That's a great question. Absolutely, the most effective way of preventing measles spread is through vaccination. The MMR vaccine is incredibly safe and incredibly effective against measles. So a lot of our outreach work is around vaccine access and vaccine safe and correct information. The MMR vaccine is one of the required vaccines for children going into kindergarten. So we do track those numbers, and we are going to be working with our schools and school communities to alert them of ongoing measles and to encourage vaccination prior to school starting. Part of that is that if there is an exposure in a school setting, unvaccinated children and staff would be excluded from school by law for up to 21 days after last measles exposure, so that they don't get symptoms and spread to other people before they realize that they are sick. Part of the challenge with measles is, one, that's incredibly infectious, and two, you can start spreading very early on in your symptoms. So you have mild symptoms that feel like allergies for 3 or 4 days before that typical rash comes on. But as soon as those mild symptoms start, that's when you're really most infectious. So it is one of the school exclusion vaccine preventable diseases. And if you are unvaccinated and exposed, you cannot go to school for 21 days. Same with healthcare settings.
How about tracking adults? I know it's a little easier children because of school systems, and we need to have a certain level of herd immunity. Where are we at with our herd immunity within Clackamas County? And are there specific populations that are way below where we need them to be, including adults and children? And how do we track adult vaccinations?
Yeah, so our vaccine tracking is focused on 2-year-old and school entry. That's what we have data on. As far as adult vaccines, we don't have a great tracking process for that. We are encouraging school administrators and school nurses to have their staff vaccination records on hand so that we can respond quickly and know who is fully vaccinated, and encourage people to find their records. So many adults have been vaccinated as children and don't have that proof and that documentation of their records, and that can be a challenge when you're trying to investigate exposures. And as far as numbers, I'm going to see if Kim wants to answer
sure.
that.
I'd be happy to follow up on that. So our kindergarten up-to-date MMR, measles, mumps, and rubella vaccination rate has actually been declining the last couple of years. In 2021, the rate was 93.7, I believe, and then for the school year 2023 to 24, it dipped down to 91%. So we dipped below that herd immunity protective threshold.
Am I correct that we should be somewhere actually closer to 95, 96%? This is actually quite concerning.
Yeah, that is correct.
Like my little spoke right up when you said that
Right,
number.
yeah.
That is a concerning number.
Yeah.
I mean, I know we've said this, I'll say it from the dais, I'll use whatever position of authority I have, not only as a medical professional, but also as a county commissioner. I also believe that the MMR vaccine is incredibly safe. I believe it's been tested over generations, and it has prevented it's probably one of the most modern miracles we've ever seen in human history to prevent kind of the spread of something that's very dangerous and very virulent. The word virulent means it's easy to catch, and it spreads rapidly. I'm just concerned here in Clackamas County, looking at the outbreak increase. I don't want us to see us tip over that threshold where it's really becoming more rampant through our community in a way that I don't know, that would be not only just a challenge with the healthcare system, but it could really cause permanent and lasting effects on people's lives. And it's really a brutal little bug out there. So get vaccinated. And I'm hoping you said we're coordinating with the schools. Are we actively in these specific communities that do have low vaccination rates within are we in their, I don't want to say in their business, but are we in their business in a way that helps us maybe hopefully build some trust and appropriately vaccinate their community?
Yeah, I mean, I think that's what we're doing with our community liaison, building trust with the community members and the organizations. But yeah, we don't have any vaccination clinics at any of the impacted communities. But if there's interest, it's something we would explore.
Yeah, we've been offering it, as has Marion County. And I do want to say that we're doing outreach to multiple communities that tend to have lower vaccination rates, not just where we have seen the disease currently, because anybody who's unvaccinated is at risk. We will provide vaccinations to children through our partnership with the Clackamas County Health Centers. So if people do not have a provider and are looking for vaccinations, we are very open to working with community groups and bringing vaccination clinics if that's desired and of interest. We can work that on. We can do that. And additionally, I believe on August 8th or 9th, and I'm sorry I don't have the information, but our Clackamas County Health Centers is doing a Get Ready for School child vaccination clinic.
And am I correct, we also can do a titer? So if you can't find your records, we can buy a titer, which is a blood test. We can see if you have the immunity properties of being exposed by a vaccine or previously actually like having natural immunity against measles and mumps, rubella. Am I correct?
Exactly, yes. So either having had the disease or having had the vaccine gives you a blood test positive for an antibody, and that means that you are immune. You can't get measles a second time, and once you have the vaccine, you're not going to get measles either. When you have that antibody, it's a proof of immunity.
And we offer that test to those that may not be able to find their records? Or any primary care provider should be able to offer that?
Primary care providers can offer that. If we find somebody during an investigation who does not have their records and need assistance getting a titer drawn, then we can certainly help with that. But it's not something that we don't have like a walk-in clinic for that, so people in the public can go ahead and go to their primary care providers for that.
Thank you.
Commissioner Scholl.
Yes, good morning. One of my questions has already been answered, and that's your actions you're taking to get ready for school when it starts in 5 weeks. But of the current cases in the county, are you able to isolate those cases to prevent as much as you can spreading of the disease?
Yeah, it is tricky in that people are spreading before they necessarily know that they're sick. And so a lot of the exposures have been in those early stages before people are aware that they actually have the disease. So that's where we really, if you are exposed and you know it, and you are under or unvaccinated, we ask that you stay home so that you don't have that potential exposure.
Okay.
And so we are working with, like you said, there are 13 people under what we call active monitoring, which is we check in with them a couple times a week, make sure that they are still doing well, try to connect them with resources if they need resources in order to safely stay at home. And that's the quarantine period, so that they don't get,
I see, okay.
don't spread it.
And if somebody feels ill, what would be the initial symptoms of the disease?
Yeah, so it starts with usually fairly mild symptoms, but it gets pretty severe pretty quickly. Runny nose, watery red eyes, and cough are kind of the main things that you see in measles early symptoms. The rash usually starts about, like I said, 3 or 4 days into the illness. And it usually starts kind of at the hairline or the head and moves down the body. So the rash starts up here. Sometimes, there are lots of viruses that cause rashes, and sometimes they start on your trunk or sometimes they start on your legs. This one is very typical, kind of a hairline down the body. Fever also is a very typical and usual symptom, and it can be quite high, up to like 104 degrees, which is also unusual for a viral illness. The fever usually starts right before the rash and stays through that beginning of the rash process.
All right, thank you.
Commissioner Schrader.
Yeah, we have folks now who have already contracted it. You said some folks and some children in the hospital. What are some of the lasting effects of the virus, assuming they get it? That's what my concern. What does it lead to?
So there are several complications that are associated with measles. Probably the most common one is ear infections. Severe ear infections can lead to hearing loss. That's pretty rare. A treatable ear infection is pretty common with measles. Pneumonia also. Oftentimes you do resolve pneumonia, but it can have lasting effects. The main concerns are when it causes what we call encephalitis, which is an infection of the brain, and that can have lasting neurologic effects or death. There's also a very unusual neurologic manifestation that comes like 7 to 10 years afterwards, which we did have a case of this in Oregon several years ago. I know, it's bizarre, but really, really sad, where somebody recovers fully from measles, but then has a sort of acute onset neurologic degeneration that happens years later, and that could be fatal too. So that's incredibly rare, but there are very serious consequences of measles. One of the concerns in discussing with community members right now is that people feel that it's a mild disease and it's just kind of a rash, and it really can be
Used to
quite
it, but
severe.
that's what I recall, being one of the first generations to get measles vaccines and polio. Yeah, that it was the secondary effects, even if you survived it long.
Right.
It's kind of like long-term COVID, huh? In other words, these things can cause,
It can cause long-term damage, yeah.
yeah.
Thank you. Quick question. Obviously, the people who have contracted measles have not been vaccinated.
That's correct.
Were those adults? What was the percentage of adults versus children?
Yeah, so the age range is from about 1 to 49. Most
And
of,
I'm talking in Clackamas County.
so of the 7 cases, 5, I believe, are in the 20s, 30s, and they're children. Marion
So-
County is different.
Thank you. You know, that's good enough. So overwhelmingly, the people who have contracted measles in Clackamas County were adults. Now, according to the newspaper article, and they were very cryptic in their language, that they thought that these groups in Marion County and Clackamas County who had association together, that they may came from a certain geographic or otherwise same community. Were you able to substantiate that?
Yes and no. So there are known connections between many of the cases. There are suspected connections, but unconfirmed connections for many of the cases. So what I
Where
can say
I
is that it's-
understand some of these people may not want to be vaccinated, they may be new to Clackamas County, they may be new to the medical establishment that we have established. I'd like to say measles is very serious, and it's very deadly. You may have the right yourself not to be vaccinated, but you do not have the right to infect other people who may not know the dangers of measles. I just want to say that from here. They do need to be vaccinated. Commissioner Schrader is right. I think our generation, most of the people sitting here, except for Commissioner West, were some of the first to be vaccinated. I remember my dad took me to Malala Elementary School. We stood in line, bam, we had it done, thank you, ma'am. And I've been healthy since then. And this is a very good vaccination, like you said. It's been decades in the making, just like polio. I grew up, one of my best friends was severely crippled because of polio. Actually, it was another reason why she got polio. But, you know, and I understand the vaccination for polio, those rates are going down as well. And so there are some good to be happen with our vaccinations. Commissioner West.
I mean, and Dr. President, correct me if I'm wrong, it is very dangerous for a pregnant woman to contract measles. It can cause severe birth defects and even blindness.
Yeah.
So it's more than a rash and a high temperature. You talk to the lingering impacts that can happen later down the road with additional disabilities that can happen. So there are we are so vigilant against this, one, because it's so virulent, it spreads so easily before you even know you're spreading it, and there are it's not just a flu. There are significant real health outcomes that impact people for forever, or we lose those individuals even sometimes. So especially those that are immunocompromised and that are that need to have the protection of herd immunity, we are way too low on our herd immunity. That is not a good number. That is a little bit concerning to me. I hope we can get that number up quickly. And I know we have a lot of trust to build, and I think we got to figure out how to do that in a way that makes people feel like they're part of something and that they can trust us. So I hope that we're being creative in how we can build those relationships so people will get this vaccination. I know there's a lot of controversy around vaccinations. In my opinion, this is one that has just been so tried and tested over time, and the science and the evidence is clear that the overall benefit to the individual and to the community is just immense. So thank you for the update, but I just want to make sure that people know how severe it is.
Yep, thank you very much
Thank you very
for
much.
coming forward. Gary, what's up next?
Thank you. Chair, would you please convene as the Water Environment Services Board of Directors?
I will recess as the Board of County Commissioners and convene as a Water Environment Services Board of Directors.
This is requests for consent agenda for Water Environment Services. Item 1, approval of an amendment with Consor North America for the Intertie 2 pump station and force main expansion. Amendment value is $1,419,450. Total contract value is $3,255,716. Funding through Water Environment Services Sanitary Sewer Construction Fund. No county general funds are involved. Greg Geist, Director of Water Environment Services. Go ahead, please.
Thank you, Gary. Good morning, directors. We're excited about this project. This is a 30-inch force main that will take wastewater from Highway 224 near the CarMax down to our facility here in Oregon City. This is a big, complex project, and we typically do these in phases like this, where we have initial contract, conceptual design, final design, and then engineering services during construction. So that's essentially what we're looking at here for the force main portion of the project. So down the road, well, probably in a few months or less, you will see another amendment for the pump station portion of the project.
Okay. Any questions or comments? Seeing no objections, thank you.
Item 2, approval of an amendment with Jacobs Engineering for the Tri-City Outfall Project. Amendment value is $806,051. Total contract value is $2,061,086. Funding through Water Environment Services Sanitary Sewer Construction Fund. No county general funds are involved.
Again, very similar. This is our outfall project with our tunnel boring machine. We are entering the construction phase and need engineering services during construction.
Questions or comments? Seeing no objections, thank you.
Chair, if I may, Greg, in the future, could you, if there's anything that is an overrun or potential overrun, could you cite that for us going forward on this project?
Yes.
Concerned about all the rock in that area.
Yeah, well, we did a lot of geotechnical boring, and we're as confident as we can be, but it's always a risk.
Thank you. Seeing no objections.
Thank you. Chair, would you please reconvene as the Board of County Commissioners?
I will recess as the Water Environment Services Board of Directors and convene as the Clackamas County Board of Commissioners.
You'll meet as the Board of Commissioners for the rest of this agenda. Next is request for consent agenda for the Board of County Commissioners. First, elected officials, the Sheriff's Office, item 1, approval of a work order under contract with DPI Security for uniform screening services at designated county court-related facilities. Total value is $759,179.16 for 1 year. Funding through fees and fines, and $593,816.40 in budgeted county general funds. Nancy Artman, Finance Manager of the Sheriff's Office, and Captain Malcolm McDonald from the Sheriff's Office. Go ahead, please.
Thank you. Good morning, Chair Smith, Commissioners. This is a work order. It is completed on an annual basis to allow for hourly rate changes for personnel that provide security screening at the Clackamas County Courthouse, Juvenile, and the Justice Court.
What does uniform screening mean?
They are the individuals who will be at the entrances of those facilities and will provide screening services. So individuals will, similar to the TSA check at the airport, individuals will empty pockets, they'll go through a screening process, and they'll be cleared for entrance.
Do you have a comment, Malcolm?
No, she hit it. It's just like TSA. So their personal items go through X-ray, and they go through a metal detector. And
Okay, thank you. Commissioner Scholl?
Yes, good morning.
Good morning.
How many personnel does this provide for, and is it for 5 days a week, 8-hour shift for the security?
I believe it is 2 screening personnel in the courthouse and 1 in the other 2 locations. And in the packet, Commissioner, I'm trying to get to the page.
I looked at that, I didn't see the number.
Let's see, but it outlines the schedule. So for the courthouse, it is 5 days a week. For others, like drug court, it's 1 hour. It just depends when they're in session. For the number of personnel, I'm happy to look into that and get you some additional
Okay.
information. I don't seem to have it
So
available.
the court agrees that this is adequate staffing for this function?
I believe so. This has been in place for several years.
Okay, good, thank you.
You're welcome.
Commissioner Savas?
Yeah, maybe I perceived the comments a little bit incorrectly, but you just mentioned that this is, basically already in place, essentially?
Correct.
Okay, so do you see a need or a change for the new courthouse?
There will definitely be changes. That's not something that I'm prepared to speak to or have direct information, but absolutely. And I'm sure that that's something that Lieutenant Thies or the sheriff or undersheriff can address for you.
Okay, and the other thing I noted, and that is, so I didn't realize that there was a private company, but, because when I've gone through the courthouse, I see a sheriff's deputy there. So this is both, essentially, as far as not, this doesn't reflect the sheriff's staffing piece, but there is both, private and.
Correct.
Okay.
In an instance where an individual refuses to go through screening and they have business in the courthouse, the deputy would assess that individual, so they're there for different purposes. This is through a qualified rehabilitation facility. It's a contract with the Oregon Department of Administrative Services, so it is a private company that's providing the service.
Thank you.
You're welcome.
Gary?
I can answer that question. So this is for the current courthouse and facilities, not the future replacement courthouse. There'll be more entrances to their future courthouse, so this will be changed when that time comes. This is only a 1-year contract for current facilities.
Okay, thank you. Seeing no objections, thank you very much.
Thank you.
Okay, still with elected officials, Sheriff's Office, item 2, approval of an amendment to an intergovernmental agreement with the Oregon Department of Corrections for additional funding toward community corrections programming. Amendment value is $906,307. Total agreement value is $14,869,113 for 2 years. Funding through the Oregon Department of Corrections. No county general funds are involved.
Good morning, Chair Smith, Commissioners. This additional $900,000 comes out of this last legislative session where the body allocated an additional $16 million for community corrections statewide, specifically to address the increased cost of personnel and contract costs in all 36 counties. As you may recall, the last legislative session, community corrections funding was significantly reduced as a result of a reduction in the population of individuals on supervision. So through a lot of hard work with our legislators, key legislators, and our Association of Community Corrections Directors, our Association of Counties, Association of Sheriffs, and our Association of District Attorneys, there's a lot of work that went in to work with legislators to get this funding, and it was critical statewide to keep community corrections stable and programs in place as we enter a new legislative session where we see an increase in population and with the legislative changes with 4002. So critical locally to keep our programs whole and stable.
Further questions or comments? Seeing no objections, thank you.
Thank you. Next, tourism. Item 1, approval of an amendment to a professional services contract with Travel Oregon to tourism to receive funds to implement the fiscal year 2024-2025 Regional Cooperative Tourism Plan. Contract amendment value is $400,000 for 1 year. Total contract value is increased to $800,000 for 2 years. Funding is through Travel Oregon. No county general funds are involved. Samara Phelps, Executive Director of Tourism. Go ahead, please.
Good morning. Nice to see everyone. So this is an amendment to an existing contract that has been, actually, we've been serving in this role for 20 years, but the geography is slightly different than Clackamas County. It's the Mount Hood and Columbia River Gorge, and it is funded through the state transient room tax. So we serve our mountain communities, and through this funding are also serving the Columbia River Gorge communities. And what we like about this is it allows us to lead that implementation of state TLT to support our local communities and the priorities that we know exist.
You say mountain community. Is that the Mount Hood territory?
So Mountain Hood Territory, the way we brand for tourism is all of Clackamas County. This is Estacada, Boring, up over the mountain, and then Troutdale to the Dalles.
Does it include Canby and Molalla?
Canby and Molalla are included in your Clackamas County tourism work, but not this work.
Okay. I'm just making sure on that. Thank you.
Yeah.
Okay. Any other questions or comments? Seeing no objections.
Thank you.
Thank you. Next, Transportation and Development. Item 1, approval of an amendment removing funding obligation deadline from grant agreement with the Oregon Department of Transportation for the Sunrise Corridor Community Visioning Project. No fiscal impact. Total grant value remains at $4 million for 4 years. Funding through the Oregon Department of Transportation. No county general funds are involved. Dan Johnson, Director of Transportation and Development. Go ahead, please.
Thanks so much, Chair Smith. Commissioners, this is a pretty simple amendment. ODOT is requesting this amendment to the grant agreement in order to remove the requirement for the obligation of funds by December 31st of 2024 and include an expenditure deadline of December 31st, 2026. In short, they're extending the term for the usage of these dollars. These dollars have been targeted towards the Sunrise Visiting Project, which is currently underway. We expect to have some deliverables to this board, hopefully by March of next year. It's kind of our estimated deadline for delivery. But in short, all this amendment does, there's no adjustment in cash. It simply extends the deadline. I'd be happy to answer any questions you might have.
Commissioner Scholl.
Yes, okay, so originally we anticipated seeing some report from Jacobs Engineering by December of this year, and so why is that being moved to March?
Well, there will be information that will be shared, but the final deliverable documents that the board will act upon will be in March.
Okay.
Yeah.
All right, thanks.
Any other comments? Seeing no objections. Thank you.
Thank you. Next, Technology Services. Item 1, approval of a board order authorizing a purchase order for Adobe Enterprise volume licensing through a cooperative contract with Dell Marketing. Purchase order value is $203,786.91 for 1 year. Funding is through department cost allocation and direct departmental billing, which may include a small portion of budgeted county general funds. Lanu Parapilli, Director of Technology Services. Go ahead, please.
Thank you. Good morning, Chair and Commissioners. I'm here to request your approval for the renewal of our enterprise licensing agreement for our Adobe products. We use Adobe products quite extensively throughout the county for reading, editing PDFs, for creative design as well as e-signatures. Most of the funding is coming from the direct department billing based on the number of users and the usage. And a small percentage is allocated, the overhead is allocated. The purchase is through a governmental cooperative agreement through the Dell Marketing. Total contract value is $203,786.91 for a 1-year term. And this includes the renewal cost as well as the true-up from the FY 23-24. Thank you.
Questions or comments? Seeing no objections. Thank you.
Thank you. Next, Health, Housing, Human Services. Item 1, approval of an amendment extending the duration and increasing the rent amount of a lease with North Clackamas School District for Women, Infants, and Children Program Services at the Wichita Center. Amendment value is $11,227.56 for 1 year. Total lease value is increased to $37,703.16 for 5 years. Funding is through federal pass-through funds from the Oregon Health Authority. No county general funds are involved. Rod Cook, Director of Health, Housing, Human Services. Go ahead, please.
Good morning, Commissioners. This agreement is for Clackamas County's Public Health's Women, Infant, and Children's, the WIC program, to continue providing services at the Wichita Center in the North Clackamas area of our community through June 30, 2025. 1/3 of Clackamas WIC participants receive their WIC services through the Wichita Center. In-person services are currently offered 5 days a week, and appointments are booked 1 month in advance.
Questions or comments? Seeing no objections. Thank you.
Item 2, approval of a revenue grant agreement from the Oregon Department of Early Learning and Care for the Clackamas Early Learning Hub programming. Amendment value is $341,768.46. Total agreement value is increased to $2,129,032.46 for 2 years. Funding is through the state of Oregon. No county general funds are involved.
Yes, the Birth to Five Literacy Program is a state-funded to Oregon Early Learning Hubs as part of Oregon's vision to expand literacy across the state. The Clackamas Early Learning Hub would use these funds to provide professional development to early educators and home visitors in supporting young children's literacy, as well as getting books into the hands of our youngest learners and their families.
Questions or comments? Seeing no objections.
Item 3, approval of an amendment to a grant agreement with the Oregon Criminal Justice Commission for the Driving Under Influence of Intoxicants Court Program. Amendment value is $54,459. Total agreement value is increased to $188,771 for 1 year and 9 months. Funding is through the Oregon Criminal Justice Commission. No county general funds are involved.
This grant supports the DUII treatment program, a cooperative effort between Health Centers Division and Clackamas County Courts. This funds treatment, housing, and other supportive services for participants.
Questions or comments? Seeing no objections.
All right, thank you. That is all the requests for consent agenda. They will all be on this Thursday's business meeting agenda for your final action, Commissioners. Next, State Homelessness Emergency Order Program Update. Commissioners, you asked for this several weeks ago. Staff will give you an update on how we're doing on that program. Rod Cook, Director of Health, Housing, and Human Services, and Adam Brown, Deputy Director of Health, Housing, and Human Services. There was a memo in your packet. Go ahead, please.
Yes, this is an informational update on program services and funding made possible by the state homelessness and emergency orders and related legislative action. This is an informational update only. I have our Adam Brown here, who's been intimately working on this issue for us for the county.
Good morning, Commissioners. Adam Brown, Deputy Director, Health, Housing, and Human Services. So, as you know, Governor Kotek signed emergency orders on homelessness shortly after taking office in January of last year. The emergency orders paved the way for legislative action to allocate new one-time state funding for homeless services, including outreach, housing retention, and rapid rehousing. Clackamas County was allocated a total of $7.3 million, and that funding came with specific goals. We worked over the summer and early fall to design and launch new programs to meet those goals. As you know, the programs were built with a priority for serving our rural communities, given that the bulk of our housing services resources, the Metro Supportive Housing Services Measure funds, can only be used within the metro urban growth boundary. We were able to build the first ever rural area homeless services outreach teams and serve rural households with new rent assistance and housing placement funding. In partnership with our network of homeless services providers, including Clackamas Women's Services, The Father's Heart, Love One, Ant Farm, Northwest Housing Alternatives, Northwest Family Services, Up and Over, ERCO, and Parrot Creek, we met or exceeded all the goals established by the state. This winter, the Oregon Department of Housing and Community Services evaluated program outcomes and supported the Oregon legislature in securing funding to sustain and build on the successes of these new programs. Clackamas County was awarded an additional $11 million to fund programs for 1 more year through June 30th, 2025, which is the end of the state's biennium. This includes $4.6 million to sustain the street outreach, rent assistance, and rapid rehousing programs, plus $5 million for the new long-term rent assistance program that will support the newly placed households from the rapid rehousing programs that were part of the initial award, and $1.4 million for the new access centers in Sandy and Estacada that were funded as part of our city-led initiatives campaign. So I think the takeaway here is that this has been a really tremendous opportunity for Clackamas County. You know, we've talked about this out of the gate, that there was some initial hesitation because of the pressures we were already facing within our system and concerns about the administrative overlay on this funding. But you know also that we were in the midst of repositioning our resources and taking, all of our pre-SHS resources and prioritizing for them for use in our rural communities. And that simply wasn't going to be enough. It was going to leave a lot of unmet need in our rural communities. So this new funding has been a game changer for us. As a point of reference for you, prior to 2020, the SHS measure, we had about a $10 million budget for homeless services in all of Clackamas County. Now, this alone is an annualized allocation of about 11 million. So over the course of the biennium, the state's now working on the 25-27 allocations. We're informing them about the costs of sustaining these programs for another biennium. We know OHCS is going to be working with the legislature to help that come to fruition. And so, like I said, as a point of reference, we had $10 million for all of Clackamas County. Now we're going to have $10, $11, $12 million a year just to focus on our rural communities. So I think our system is doing a really, really good job. This is a good opportunity for us, and we certainly capitalized on it by demonstrating what we're capable of here in Clackamas County. The state has taken notice of that, and it's resulted in sustaining this funding.
Thank you. Commissioner West.
Thank you, Adam. Great update. I want to talk about on this page here where you have a table, and in the middle of that page is homeless prevention and rapid rehousing. Looks like under contract to provide. Now, can you explain, when we see rapid rehousing, it says service prices women, Clackamas Women's Services, we're not just rehousing women here, right?
No.
Can you explain that?
Yeah, so Clackamas Women's Services is one of our longest serving, most stable, and most equipped service providers in all of Clackamas County. They served as an air traffic controller for the administration of the rapid rehousing program. So we had one contract with them, and then they subcontracted with the other agencies that I listed, including Ant Farm, NHA. NHA is one of our biggest providers too, but it made sense to consolidate the administration. And you know, Melissa Earlbaum, CWS, she's an all-star, and she held so much of this responsibility. So that's what we mean there. They're a primary contractor, but they played air traffic controller.
So thank you for that explanation. You see the funds there. It says homeless prevention, evictions prevented for over 180 households, preventing homelessness for hundreds of people in rural Clackamas County. And then rapid rehousing, 260 households were placed into rapid rehousing, which included navigation support and short-term rental assistance. These populations seem to be somewhat similar. I'm wondering if they're fluid and they go between the two different groups. And then what is the overall effort to help them leave this risk pool? So we see them become a little bit more stable member of our communities, so that we can either have funds available for someone else that needs it or reduce the needs of the funds.
Yeah, two really great questions. So homelessness prevention is helping people keep the housing that they already have. Right, so that's short-term rent assistance. It could be some rapid resolution stuff if they're facing, one-time medical expense or something like that. The rapid rehousing is serving people who are literally homeless. It's getting them back into housing. And so yes, they both come with that short-term rent assistance because rapid rehousing programs are intended to serve people for up to a year, get them housed, and then we sustain them if they need with a long-term rent assistance program. So when the state first launched this, it didn't come with long-term rent assistance funding. And they said, bear with us, right? First priority is getting people off the streets. So we're gonna fund rapid outreach and rapid rehousing, get folks off the streets, and then have faith that the legislature will get it together and come with some long-term funding. So now we're working on that transition of the people that we rehoused with that initial allocation. They're now coming up on 12 months. So with each household, it's a conversation about what are we gonna do? Was that 12 months sufficient to stabilize you and we can preserve the long-term rent assistance capacity, which is effectively a voucher program now? We know that if we're able to help people move off of that program, there's another household that we can catch there. So yeah, it comes with case management support. So we're going through that process, house by house. Are you good now? You stable? Okay, we don't need to transition you to this long-term support. Or for households that are on that long-term support, of course, we're doubling down, tripling down. What sort of self-sufficiency support can we give them to ultimately move them off the program?
Are we connecting those people to workforce opportunities? So I know that Commissioner Schrader works heavily with workforce opportunities, but eventually like stable employment really matters for these, for as much as we can get to help some. I'm wondering if we're tying in some of that when we get somebody stabilized.
Yep, it's all of the above, Commissioner. It's, benefits acquisition, so folks are eligible for Social Security, things like that, problem solving there, getting them, the health supports that they need, getting them the workforce supports that they need. So, yeah, this is a huge focus right now of our system, and you'll see us talk more about this. We're going to come to you in a few weeks with an update to our supportive housing services spend down plan. To preview that, one of the things we're going to propose to you is some move on programming, making investments in move on, because we're reaching the full program capacity now of even our SHS funded long-term rent assistance program. So we really need to focus on helping people move on so that we can continue serving households in these programs.
Thank you for answering my questions.
Yep.
Commissioner Schrader?
Yeah, thank you for mentioning workforce, Commissioner. I appreciate that. So can you get me information on what your nexus is with, like, Clackamas Workforce Partnership and the one-stops and all that infrastructure that's available, and what are they doing to help you?
Yeah, and
that
I can follow up on that and get you some more information. But really, all of our service providers, we have a pretty well-coordinated system. So our service providers are doing that as part of their case management supports of households, making sure to connect them to our workforce system. But
Okay.
Commissioner, I'll follow up and get you more specific
you.
information about that.
Is that it?
Yeah.
Commissioner Savas?
Yeah, as I'm looking at this chart at the bottom of the attachment, at the bottom of the staff report here, it's awfully prescriptive, and what's not there, similar to the next topic, but you're not here for that. And you mentioned supportive housing services is, drug treatment, mental health facilities, which are services, which was abandoned by the state, which seems, again, these are state dollars. I just want to make the note that they ought to be prescribing and funding more of both. And to do this, I think we're going to have limited success, similar to our discussion last week on Population A, in the metro region. But if they don't recognize this, I don't know what the barriers are. Any insight as what those barriers are? Is it they don't want to do it, or they don't feel there's a need? Why is that not included, do you think? I know it's not your fault, but just your insights.
Yeah, I mean, I think part of the challenges are siloed systems, right? This funding is administered by Oregon Housing and Community Services, which is a housing and homelessness agency. And we're trying to, so we don't have control necessarily, limited control over how the state administers these programs and the program terms that they put on them. For example, what is an eligible use of the outreach allocation? You know that, right? That's prescriptive. That's what you're getting at. But I do think in Clackamas County, we're looking at this from the recovery-oriented perspective because we know that households need that addiction support, drug treatment, ongoing support to be able to be successful long-term. And so I think we are within our systems. That's the beauty of having a health, housing, and human services department that is the local mental health authority that has an FQHC. We're working every day across our divisions to try to solve for that locally with what we can control. But I certainly agree with you that at the level of our state partners, trying to work across those systems more and more is definitely needed.
Good, thanks.
Commissioner Shaw?
Good morning, gentlemen. Okay, so when you work with a nonprofit like Clackamas Women's Services, you mentioned they do air traffic control. Okay, so they're subcontracting with other nonprofits. Do you still have the same visibility on the use of those funds through, does it come directly from the subordinate nonprofits, like Ant Farm in this case, directly to you, or does it go through, is it reported back up through Clackamas Women's Services?
So we do have direct visibility. Okay. And in this program, it really was a full partnership up and down, right? We were helping determine of the voucher capacity we had here, which was 170 households, we sat down with the service providers, Clackamas Women's Services, and said, okay, Ant Farm, what's your capacity? Up and over, how many people can you serve? NHA, what do you think? And so we broke apart that 170 in those subcontracts. Now, administratively, it's consolidated there with CWS, but we do have that visibility in terms of the program outcomes, program design, all of that.
So the centralized administration being done by Clackamas Women's Services, that means there's less administrative cost to those subordinate nonprofits. Is this more efficient?
It is more efficient.
Okay.
Yeah, it's less duplication. It's certainly more efficient for the county. Now,
Okay.
I'll acknowledge CWS picked up more responsibility. Some of it was offloaded to them in a way, but I do think it was a net gain for the system so that we didn't have to have 5, 6 different contracts with the county.
Okay, thanks.
Any further discussion on this item? This is just an update. I want to thank you. Yes, we'll take more money, hoping that this doesn't overlap with other programs because we really don't need redundancy. We need new ideas, and I think you've done that.
Yeah, and Cheryl, I will mention one more thing, which I didn't say in my remarks. This has involved a lot of coordination with our rural communities, too. The elected leaders in our rural communities, their city managers, everybody's been at the table. We're all rowing in the same direction. I think we've seen some pretty positive outcomes. Vahid Brown and I have been to every city council in our rural communities. Those relationships are, I think, better than ever, and it's a good thing for our county.
I'm glad you mentioned that because there are rural communities, I think, may have been hesitant because they didn't know, they certainly didn't have any money. And this is serving a very, very vital part of our county. Thank you. Rod?
Just quickly, back to Commissioner Savis's comment or question. Oregon Health Authority, I think the board can, if they start advocating to Oregon Health Authority about more money for treatment, that might be the way to go, because that is one system that is starting to talk about drug and alcohol and prevention again after a few years of not talking about that. So they're dealing with the youth side and the younger side. But in terms of getting some treatment, I think some advocacy from the board might be extremely helpful.
So how do we go about that? Is it through PGA? Is it?
I think PGA, I know they're beginning to prepare to come to you for the next legislative session, what we'll be all interested in. I think that's something the board might want to take a look at.
Okay, thank you.
Commissioner Schrader?
Yeah, speaking of, the dollars that you get, I do know that the USDA oftentimes has funding for housing. Have you ever looked at their programs for our rural communities in terms of gaining dollars at the federal level?
Yeah, and that's mostly affordable housing development, and
Okay.
and yes, because the USDA is focused a lot on workforce housing,
Right.
And agricultural, housing for agricultural workers, et cetera. So yeah, that's something that we always have our eye on with our housing authorities development team, is making sure we're attuned to those funding opportunities.
Okay, thank you.
Commissioner West?
I am really glad that you brought up the nexus between like addiction and treatment and substance abuse disorders and all those things. I'm hoping that maybe the legislature will be open to how housing intersects with the recovery campus and how we can tie in through the care continuum the type of housing someone needs exactly where they're at, where it's low barrier all the way to workforce housing, all the way through that care continuum, right? So to bring that piece of stability, I'd love to know your thoughts on where we should be maybe going from your guys' boots on the ground, like as we advocate moving forward. But I think you guys are right. We are still lagging statewide on those issues. So thank you for bringing it forward.
I'll preview one other thing for you.
Please.
OHCS just sent out a solicitation that said, hey, we have a balance of funding from these EO initiatives. We think we should focus on high-needs behavioral health housing. Counties, please submit proposals to us. And Vahid and I said,
yes.
Yes. And so we set an immediate meeting with them. They have about $3 million. We're about to go through our scattered site disposition process. We're going to prioritize 75 of those households for recovery-oriented infrastructure. SHS can't bear the whole burden. We immediately called the meeting with OHCS and said, it's almost like you wrote this solicitation for what we're going to propose to you, because we need funding to sustain those houses long-term. So Commissioner West, I want you to know, we're looking to the horizon, and we're going to go after every dollar that's available to do exactly what you're talking about.
Adam, how competitive is that funding? How many people are going to jump in, and then how, and I think we have a great track record that the state can trust. I just, I know this is competitive at times.
It is competitive, but I think that we're a little bit ahead of our peers on our thinking and our readiness and trying to capitalize on each next opportunity. I would be really surprised if we aren't successful in that. They said that they don't want to cut that $3 million into too small of parts, so they're going to make maybe 2 or 3 allocations from it. We're going to give them a really compelling proposal. We'll seek your permission to apply for that funding in August. The application's due in early September, but we're trying.
Does that free up additional dollars potentially that was going to go towards these scattered site housing that could be potentially pushed back towards the recovery campus?
No, this is operations.
Operational,
This is
okay.
operations funding, yeah.
We already approved the 75 scattered sites. We've already voted on that, Commissioners.
Yep.
So they would take, I don't know, 2 or 3 of those and set them aside.
Yep.
Okay, all right, we need to move on, Commissioners. Thank you very much for the update. Gary, what's next?
Thank you. Next is proposed comment letter to Metro on supportive housing services. There's a draft email letter in your packet. Emily Klepper, Senior Policy Advisor to the Board of County Commissioners, will present. Go ahead, Emily.
Morning, Commissioners. So I was here last week with Adam giving you an update on the conversations regarding the SHS reform discussions. The board requested a letter reiterating your request to Metro Council to convene a meeting of the Metro Council representatives and the 3 county boards. Your formal comment letter is on the record from June 27th still, so this would just be a reminder that you had initiated this request and solicit a response, particularly about convening this meeting. So we have a draft in front of you. It's a simple email is what my recommendation is from Chair Smith on behalf of the board to President Peterson.
Yeah, please take a look at it, Commissioners. Commissioner Savas, you're up.
Yeah, thanks, Emily, for putting this draft together, and I put a lot of thought since I saw the draft into what I wanted to say initially when I proposed either I send it or the board can send it, and I agree the board should send it. I'm fine with it being an email, but I would like to emphasize the mental health drug treatment and service thing. So my suggestion is this, colleagues, on this sentence, a little edit. Where am I here? The sentence starts out with however, comma, in advance of any final decisions regarding support housing service, it's imperative to share essentially about service cost delivery and challenges, comma, such as, this is my add, such as insufficient drug addiction and mental health services. Now,
Such as
my
insufficient-
point is, maybe it needs to be wordsmith, but my point is to speak about the insufficient funding or the insufficient service level, but that is primarily a missed area. So that's what I would like to address.
About those 2 particular.
Those 2 particular, such as, yeah, because
Got it.
that's a big gap that is not being addressed, and all the messaging I've heard from Metro and staff on this topic, they seem to be silent on that, and that is a huge omission in my opinion. And I also think that if we can, again, not change the letter, but in the context of what we're asking for is a group discussion, I think just as we just had with Adam and Rod, if we can draw attention to the fact that this is a shortfall, we can all advocate, not just Clackamas County, we can all advocate for more funding and draw the state's attention to this.
So I'm going to read your language, Commissioner Savas, such as insufficient funding for drug and mental health services.
Yes.
Okay, I think that's pretty, I wrote it down. Any other comments from commissioners on this? Gary, do we need a motion?
Yes, please.
I'll accept a motion with an amended version.
Chair, I move that we approve the letter before us with Commissioner Savas's amended suggestions for this letter to the Metro Council.
Second.
Commissioner West has moved approval that we send this letter as amended with the remarks I stated earlier to Metro President Peterson, and Commissioner Schrader has seconded the motion. Further discussion? Seeing none, would the clerk please take the poll?
Commissioner Schull.
Aye.
Commissioner Savas.
Aye.
Commissioner Schrader.
Aye.
Commissioner West.
Aye.
Chair Smith.
Aye, motion passes 5-0. Thank you very much. Up next, Gary.
Thank you. Next, update on ZDO-288 utility facilities. There's a memo in your packet. This is scheduled to be on your business meeting for this Thursday. Dan Johnson, Director of Transportation and Development, and Jennifer Hughes, Planning Director, will present. Go ahead.
Thank you so much. Chair Smith and Commissioners, we are here, information only, no action needed. I'm just providing some information about the ZDO package that's scheduled for this Thursday. On June 12th, 2024, the board held a land use hearing on the proposed amendments to the Comprehensive Plan and Zoning and Development Ordinance. Those were primarily around utilities and how utilities are cited and land use requirements associated with that. The board voted 4-1 to approve the recommendation from our Planning Commission regarding these utilities. And I'm just a quick reminder, the Planning Commission recommendation was that conditional use or non-conforming use permits for natural gas and electrical distribution of transmission lines is required, but only on properties not owned or controlled by the utility provider. That was the Planning Commission recommendation that was approved. So essentially, this recommendation hinges on the authority basically to condemn properties by these utility entities and essentially requiring land use approval if they don't control any entities or any elements of property for the particular lines. We have been made aware of some new information. There's some inconsistency of the information that we are getting from the PUC, Public Utility Commission staff. And we felt that it was important to come and talk to you because this is new information that may impact the discussion we're going to have with you on Thursday, okay? So essentially, I want to just draw attention to the last line on the page 1 of your report that basically says, to ensure that a utility line requires a land use application, tying the requirement to the need for condemnation as recommended by the Planning Commission is not sufficient. We cannot affirm to you that the PUC will or will not grant authority for any utility to go condemn before or after a land use process. Because if you recall, our thought was they would come, get a land use process approval, go back to the PUC, because we don't give condemnation authority. This board does not give condemnation authority for this utility. But they would come to us, get the land use approval, go back to the PUC, and then condemn if they need to, or negotiate, I should say. We cannot affirm to you that's going to take place. And so knowing that, we felt it was important to come and share this information with you. We also should inform the board that based on this new information, should the board wish to reconsider, you have the ability to do so. And you don't have to have another land use hearing. Essentially, at Thursday's business meeting, the process would be as follows. We'd open up the business meeting. Staff would prepare the materials that you already voted on, share that information with you and the public about the current ZDO amendment proposed. We essentially would provide information to you publicly during this hearing on this new information. And at that time, there's a couple options that are available to you. One is you can keep heading down this path with the current proposed language, okay? Or you can simply direct staff to go back and amend the proposal. The amendment can be as simple, and we provided 2 options up here for you under certain themes that we've been thinking have been important to the Board of County Commissioners. The first one is direct staff to revise the draft amendments to require a conditional use and non-conforming use permit only for above-ground electrical transmission lines, regardless of where they are, okay? Because again, transmission is the concern that you've been having. Not distribution. Distribution is to the local communities. It's the transmission of power through the community. The second expands that and adds gas, because there was a concern that was raised by a commissioner about gas. We did omit the word below ground or above ground electrical, but essentially all we've heard from the board to date is above ground, large scale transmission are an area of concern. We'd be happy to answer any questions you might have, but that's basically the information we're here to share with you today.
So I have a lot of thoughts on this, as I expressed to you last week in my office. I want to know how any of these changes will help PGE provide electricity to the users quickly for either during maintenance of an outage or during a state of emergency.
They should have, well, let's,
Okay, my question is, regards around a particular individual, and then it was discovered that maybe he would have to go through this land use process to make a repair.
yeah.
Okay, that's ridiculous.
The way the code currently is being interpreted, they'd have to go through a conditional use for that process.
Okay, that
And
is
the
nonsensical,
amendment as
you
proposed,
know. Which language here says they do not have to go through that?
both of those recommendations,
All right,
yeah.
because people want their electricity when they want it.
Yeah.
And electricity is as common to us as breathing anymore. It's amazing how much we are so dependent on that. So let's say, unfortunately, we're in a fire situation. Maybe this year, it's predicted to be a very bad situation where some people may experience outages. We expect and demand that our utility provider, whether it's gas or electric, will go in and restore the power as quickly as they are physically able to do that without a government hindrance. Is that clear? Without a government hindrance, which would be a cumbersome land use process. Is that true?
Crystal.
Okay, all right. Commissioner Savas and then Commissioner West.
Yeah, well, thank you, Dan, and your staff for the remedy here for that. And it does address the chair's concern, it addresses my concern as well. And it would seem foolish to pass this up and have all our work do this again if we omitted the opportunity just to insert the word gas for future. This would just be a big staff savings in the future. And as complex and complicated this has become, I don't think we should subject ourselves in the future to that. So I appreciate the remedies and the bulleted items, and I will be advocating for the second bullet, only just, again, for staff and time savings in the future.
Okay. Commissioner West?
This has been, I guess my only concern, this is not, I mean, we get the information we get when we get it. It just seems like a little messy in a way that was already kind of contentious with our constituents. Like, I feel like that this is a relatively massive change to what we thought we were operating under. I mean, it makes sense. I don't disagree with your recommendation. I understand why the Planning Commission made the decision they did. I think this board might come to a different decision than they do. But I think with this new information, I mean, we don't really have another choice. This is what makes sense. I don't think you can have it based on who owns what property and what's condemned, not condemned, as like a patch quilt work of, I mean, that's going to be a nightmare in the long run. I'm just not really happy that we are getting kind of this new wrinkle this late in the game here after all of the effort and the time that this board's taken. So I guess I'll leave it at that. I'll be supporting your recommendation, even though I'm not really happy about how the process is playing out currently.
I now want to echo, we aren't excited about it either. A couple things to highlight. One, the Planning Commission wasn't aware of this. We just became aware of this in the last week or so, this information regarding it. In fact, we have evidence. We have evidence where a utility condemned property prior to land use. We have that data. We have that information in our hand. And the PUC is not an entity in which we have any authority or can control. So I think this language and options and the commitment that you've made to the citizens of Clackamas County regarding these lines is more viable and actionable than the prior recommendation. I'm assuming if the Planning Commission had that information at that point in time, they probably would have come to a different decision.
Thank you.
Commissioner Schrader?
So I just want to make sure I'm understanding it. Obviously, there's a difference between the transmission lines and the
Distribution.
distribution piece of this. So, assuming we do the second bullet draft amendment, what that means is, as a transition line, it will go through a conditional or non-conforming use permit. But, and what I'm hearing is that the PUC will have final authority to override that,
No.
if necessary?
No, they would, the PUC doesn't have any authority on our land use process.
Right, okay.
Well, pardon
Well,
me.
they could
Currently, as proposed, they could override that process and circumvent it.
They could, but even if it moves through as a conditional or non-conforming use, for example, if we say, no, it's not, don't go there, can they still condemn the property, I guess is what my question is.
PUC has the ability, as we've said, the PUC has the authority to authorize any utility to condemn any property at any given time.
Okay.
And hence the concern, if we draft an ordinance and adopt an ordinance that's predicated on that, I can't affirm to you that the commitments that we've made to the community and our partners is viable. So,
Yeah, in other words, we can really do this, so they'll go through a transmission line process, but in the end, the buck will stop with the PUC if they decide that this is necessary for energy transmission. That's what I'm just trying to figure out.
So I don't think the PUC would override a local denial for
Okay.
land use. So if you put them through a conditional use and the decision turns out to be denial, that should, stop the process at the PUC.
Okay.
Assuming that, but where the situation we're concerned about now is that the way that the previous draft read, the condemnation process could then end up happening first, at which point
Okay.
our rules would then say they no longer need a conditional use permit, because
Right.
we said it was only
Okay,
tied to the
got
need
it.
for
It's a
condemnation. So it's an
timing.
order. Yeah.
That's what I was
Yep.
trying to
Yes.
get my head around. Thank you.
There's a little bit different language in these two proposals. In the first one, it says above-ground electric transmission lines. In the second proposal, the word above ground has been omitted. Why is that?
that was accidental.
So if Commissioner Savas, we were to go with the second proposal, we would need to insert the word above-ground gas and electric transmission lines.
Gas and
Well,
above ground.
gas is not above ground. but
Correct, yeah.
So gas and above-ground electric transmission
Correct,
lines.
correct.
Yeah, I could accept that.
Okay, now, Gary, what's the process about going forward with this?
Actually, I looked for Jane's help. So this is Thursday's business meeting. It's scheduled as a public hearing, right?
No testimony, it's reading and adoption of a previously approved land use ordinance. So they've held the public hearing, they've taken all the testimony. The proposal originally that was broader than where they ended up, so they narrowed it. And what we're talking about now is narrowing it in a different way. So we don't think they need new testimony, because it's all within what was notified and testified, but their decision would be different. So they would need to discuss that at the business meeting publicly, and then I think have us come back with new written. That's what we were thinking, but I don't know how you feel about that.
So we need to review this 2 more times? You said do it at the business meeting and then come back for review?
Because what's coming on Thursday is what you approved before, not what you're talking about today.
And it's not posted, right?
It's posted for the old, right, correct.
So we need a public vote on the change.
Right.
And then you would basically tell us, hey, go away, make these
Okay, when
revisions.
do we take the public
Can
vote
they do
on
that
this?
today?
It's not posted. I mean, it's really about public notice. What the public thinks they're going to be presenting is this old ordinance you've already reviewed, language.
Yeah.
And so now it's a new proposal. And so best practice would probably be to renote it. If you want to do kind of a hybrid, you would have to get your paperwork posted ASAP.
We thought about that, about having this discussion today and a vote today. We feel, since it's already been noticed, that discussion should take form in a public forum. It should be at the business meeting. It can be short and sweet. We can provide this information to you. You can direct us to go away with this new direction, and we'll come back. Again, there's no public testimony because we've already had all the public testimony around it. And then essentially, we would go back, draft the language that you want to see, come back and get it approved.
Okay, can you do that by this Thursday's business meeting?
I think step 1.
What?
Step 1, you probably could.
Step 1, then we have to do it a second time to adopt the new language.
Because the step one would be you're telling us that you're changing direction. Correct.
No, you're telling us we need a change in direction. Let's be clear on that.
Recommending.
Right, we're recommending.
So
Gary?
unfortunately, there has to be two business meeting discussions, one this Thursday to direct staff what you're hearing today, and then we'll come back the following week to finalize.
Okay, so let's be clear on what I think we have a consensus here. I don't think we're voting on anything today, are we, Gary?
No, you're not.
Okay, I think there is consensus from the commissioners today that we adopt the second paragraph and add the word above ground. Is that clear, commissioners? Okay, let's let Jane and staff decide how and when we're going to adopt this.
Okay. We'll take care of it offline and report back to you. Yes.
Thank you very much.
Okay. Excuse me. Thank you. Next item is Clackamas Road Gate funding. At last Thursday's business meeting, commissioners, you asked staff, directed staff to come back with a proposal of how to fund part or all of the gate on Clackamas Road as you discussed last week. Dan and his staff and county council work together and have a proposal for you. It's in your memo. Dan will share it. Go ahead, Dan.
So the memo identifies a couple different things, one of which is funding options. So there's basically three funding options that are probably the most reasonable for this particular use, one of which is general fund. You can use that for whatever you want to use it for, but there's draws in the general fund. Second is road fund, and third is urban renewal funds. So there's funding sources out there. Staff's opinion is that we actually, within our Clackamas Industrial Area Plan documents, have verbiage in there that specifically states that there should be, it supports image enhancement projects, including landscaping, street treatments, and other efforts, which clearly fall within this definition, okay? So if you're looking between those three funding sources, we know all the focus we have on the general fund and making sure we're using that money as efficiently and effectively as possible. So I would probably rule that one out. Next is road fund. Since the idea is to possibly vacate this this road right away in the future, I don't like the idea of using road fund for property that we're going to vacate. And so hence, staff is recommending that we would probably fall within the urban renewal realm for funding. The funding mechanism that we'd be looking at, essentially, to be as efficient and effective, we would probably be, and this is not new, we've done this work before, we could do a funding and/or a development agreement with the adjoining property owner that's looking to facilitate the gate. Essentially, we do basically a reimbursement, so they basically tell us how much they spent on it, and then we would, depending on how much the board wants to fund, would provide funding up to that level. We'd require the work be prevailing wage or Bureau of Labor and Industry BOLI salary rates, and then condition the adjoining property owner with long-term maintenance of the fence, which they've already agreed to, and that's not a problem. Last but not least is a discussion around the funding amount. And so I've thrown a couple items out there. We have, although it's interesting, though the quote said it excluded prevailing wage, we have followed up with them. It does include prevailing wage rates. So essentially, I would probably advise staying away from a dollar amount for the project because, and look at kind of a funding percentage because essentially the project could increase in cost or decrease in cost based off site conditions they see out there because it's basically, it's a quote they have right now and you've all built stuff. Site conditions determine you got to spend a little bit more, so you got to spend a little bit more or vice versa. So what we have in here is essentially some verbiage around whatever the board wishes to or desires to fund to support this particular effort. I've said in there up to 25%, up to 50%, all of it, whatever, and right now the estimate is about $50,000 is kind of the current quote. You could also put in a percentage and put a maximum on it. So for example, you could say up to 50%, no more than $25,000 if you're looking to fund less than all the particular gate. So essentially we've identified a funding source, a process. Once we get your guidance on this issue, we'll work with county council, we'll develop this agreement. Again, we've got draft agreements we've developed previously, and we'll go forward and get it done.
Thank you for the documents on this. I don't see in these documents who they is. There's no reference to where the company address where this money is going to.
I believe it's Conveco.
Well, yeah, I know the name of the company, but it's not in the document. So if we were to do a motion today, we would need that, wouldn't we?
I've got the card here.
Well, I know, Martha, that's not my point.
Yes, apologies, Commissioners. We
That's
missed
not my
it.
point.
I know, but we can add it. Yes, that's what I'm saying.
We missed it in the memo, I'm sorry.
Okay, so that would need to be very specific, not only how much, to whom this is going to.
Yes.
Commissioner Savas.
Yeah, so what I gleaned from the conversation when the business owner was here was that I sensed that she was wanting to make future efforts more streamlined, and it almost seemed as though that the preference of her making the investment, or the business making the investment, was her preference to some degree, due to any complications, should there be a transfer of the property, we sell the property, whatnot. So I just want to be mindful of that, and if maybe funding a portion of it helps her with that, then let's consider a portion as opposed to all. So whether the number is 50% or 75%, but it seemed like that she wanted to have some ownership of it.
We have heard that they have a commitment to building the fence. One of the considerations about the word streamline is the reason we made it a reimbursement. Because if we, one, we don't want to build it because it's going to take us longer and cost us more to build it, number one. Number two, to get the contract in place, and you know all the contracting stuff that we deal with. Secondly, if it's a reimbursement, they can go out and start securing materials immediately, and that doesn't slow them down. But yeah, the question is, what's the amount of that reimbursement?
Okay. Commissioner West?
If the board's ready, I'll remake my motion.
Yeah, is there any further discussion? We can have discussion during the motion, too. Go ahead, Commissioner West.
I move that we fund up to $50,000 through the identified urban renewal funding to build a gate and appropriate fencing to Conveco. Did I say their name right?
Martha, did the
It's
ship?
Conveco Manufacturing.
Yes.
Yeah, that's my motion.
Is there a second?
I'll second it for discussion's sake.
Okay, Commissioner West has moved. We award up to $50,000 to Conveco for the construction of the gate and the fence, and Commissioner Savas has seconded the motion.
So, Dan, if I heard you correctly, you were suggesting a percentage versus a dollar amount.
I'm fine with anything. We can make either work. I mean, if it's up to $50,000, that's just the limit. And it's up to whatever, all expenditures to that dollar amount will be reimbursed.
Okay, okay, I'm fine.
Any other questions or comments from commissioners? Oh, excuse me, Commissioner Scholl.
Like I mentioned before, I just have one concern about this, and that being that many businesses have had expenditures dealing with the effects of homeless encampments in near proximity to their properties. And I just wonder how many claims might come in pursuant to this action.
I can speak in very general terms to that. I mean, a lot of the issues that we're facing with other homeless impacts in and around our Clackamas industrial area are within our rights of way, and so they're parking or they're camping in areas they're not designated to be camping in, but they don't have the same circumstances around this particular portion of road. It's pigeonholed between two properties. It dead ends. There's little to no visibility on it. It's off Minuteman Way. If you look at the map, it comes down, and it's just that section that's very tucked away back there. So it's less visible than a lot of the other properties or impacted businesses within Clackamas County are dealing with. I can't say that is every set of circumstance, but the ones we've been dealing with, we referenced last time we were here with Mr. Stewart, like Caps Road and 120th and down in that area. It's been kind of a target area that we've kind of been focused on, but those are very visible. We immediately get comments from local businesses around issues that are in those areas as well. So I don't think it has exactly the same set of circumstances as the other areas we're dealing with.
Okay, thank you.
Commissioner Savas?
Yeah, as I shared last week, I kind of agree with Commissioner Scholl's point, and I have a question I think is more appropriate to be asked and discussed in executive session. So I would say that, I'm glad we had this discussion, but there is a situation out there in the general vicinity that I think we could possibly be subjecting ourselves to. And I would just like to get legal counsel opinion as far as a precedent for the Me Too's. Again, getting back to Commissioner Scholl's point, I think that might open the door for, again, everything as he stated, other property owners that have been impacted. And I don't know how we craft language that protects the county financially.
The only thing that I would have to say, relying on county council, this commission would probably have to vote to approve of other circumstances. And just because a Me Too situation is knocking on our door, it does not necessarily mean we have to do what we're doing for these people as we would for others. Jane?
If I may, my understanding of staff's proposal is that they use the industrial urban renewal plan as an image improvement project, which would, I think, alleviate this precedent problem, still provide them with money, but not necessarily fund the specific gate, but fund improvements around it. Is that correct? Is that your proposal? Because it says we'll improve the physical image with techniques such as landscaping, street treatments, and other efforts.
So the street treatments is the gate. So urban
Okay.
renewal is capital focused primarily. And so we would be packaging funding. There's two primarily elements that we fund. One is the capital component, which is the gate, which would be through the urban renewal plan. Then secondly is the discussion around the garbage removal and debris removal, if and when necessary. That would be funded via the road fund, or we also currently have money for abandoned vehicles through Metro's fund. So it's a leveraging of dollars.
Okay, so if this is like an application or something that can be authorized through this particular renewal plan, it may alleviate your concerns, Commissioner.
Yeah, I would just respectfully ask that we just carry this over maybe and bring this up at the next executive session, just to make sure. I can't reveal my concerns. It wouldn't be appropriate.
So, this is the issue that I have, Commissioners. If any commissioner would have brought this to me this morning or yesterday, I would have removed this from this discussion and taken it up in executive session. Now we're at the very end of the 9/10 of the process with a motion on the table, and there is an objection brought forward that I don't like how we do business like that. I wish that if this was real, it would have been brought to my attention. I could have set it aside for more discussion. But this isn't really how we do business here. Okay, who's up next? You are?
I think so.
All right, Commissioner West.
I think there's I'm not going to look for a reason to not do this. This business has had a disproportionate impact on this issue. Too many businesses have been negatively impacted on this issue, but this business in particular, the disparity is glaring. They've already spent 6 figures in 4 months. They've already, not including the cost of loss of staff that have had to quit because they don't feel safe. You have people out there picking up biohazards and needles, lighting things on fire. This is become a blight for the entire community. This business also deserves, I think, to have their business feel safe and supported, and I think there's a way to do that that does improve the entire area and the way it looks. To be frank, let every business come. Maybe the news articles will write on that they need to be supported instead of just being told they got to write checks for all this stuff all the time. So let every one of them come. You can come talk to me. I'm available in my county office, and these are public meetings. Ask us for money. We will do our best, I think, to listen to you. I get the sense of like the Me Too and those types of things at a certain point. Today, I'm going to stand up for local businesses and what they've had to suffer through. I plan on still moving this forward and voting for it.
Commissioner Scholl.
Yes, well, Commissioner West just mentioned what I was going to say about the very high expenditure that this business has had to deal with on this problem. So with that in mind, I will support the motion.
Thank you, Commissioner Schrader.
Yeah, I have a question for council. So the decision today on this, does it set us up for legal liability in the future for a precedent of somehow, that we've done it for one, we'll do it for another? As you know, we have some folks in this county who are rather litigious, and, it's more than a Me Too, but is that a possibility?
I mean, anything is a possibility, but I do believe the solution staff has come up with under this industrial urban renewal plan. It's very specific, it's very limited, and it comes before the board. And I think, given that, I think you're as protected as you're going to be.
Okay.
Dan,
And I just want to say something about process here. And yeah, I think what happened, I think that it was an idea that my dear friend Commissioner West had there, but I'm just going to make a suggestion that next time when you have those ideas, let's talk about it first before we make a motion, and then we kind of go there, because we're having a discussion we probably should have had about it, and maybe it's a larger policy discussion, I think, about how we help our businesses. It's not just a one-off with one business. So that's really the issue for me with this. I can probably get there today, but I am worried about a precedent. And if we're going to do this, then we had better become very clear and give more direction to our economic development folks as well about what we want to do. Because remember, we're already going to be given money, at least I thought, to businesses who are dealing with recovery issues or need expansion or, that kind of help. And this might fall underneath that rubric in some ways. I don't know the answer to that. So for me, it's just like, let's try and be a little more ahead of the game and measured when we kind of make these, kind of ideas on the fly, I guess. And I'm not trying to be argumentative. I'm just saying that it would help our process to really give us a broader policy framework for this kind of activity.
Thank you.
Okay.
Dan, you had a comment?
Precedent is always a concern. And we have, by the recommendation we are putting forward to the Board of County Commissioners, we are minimizing that to the greatest extent possible. It's done through a couple of different options, one of which is the fact, how many times have you taken a board resolution to gate a road? You haven't. We've rarely done this. That's a step that you took that facilitates this. Secondly, what's the funding source? The funding source is urban renewal dollars. Those have to be spent on capital, mostly construction, things of that nature. So that's funding the gate. And so I appreciate the comments and the concerns and the other needs that are out there. And when those other needs come forward, we're really going to have to see kind of what funding sources may be available, because it may not be urban renewal. I mean, it may be something else, but we've got a variety of sources that we have that we're looking to leverage to do the best that we can do with it. And we can tackle those issues when they come forward.
Commissioner Savas?
So, give me an example. Let's say it's a property owner within the urban renewal district, and they're suffering as much or higher impacts of crime and damage as a result of it as this property owner did. And they decide that they want to erect a fence around their property. And that's going to be a huge expense. That seems to be pretty similar. They're going to make a capital expense to, certainly not a road, but, make a capital expense. They're in the urban renewal district, so that would be subject to some precedent.
That's a
And
decision
that's
the
why-
board will have to make. I mean,
That's
I agree, but there's some things that are different. It's our road right now.
Right.
It's our road, it's our ownership. They're sitting on that piece of property that we currently, not property, easement that we currently have a right to. The board took an action to gate that road, or not, pardon me, to gate and to post that road. And, I mean, every case, I don't disagree, that's a discussion that can come forward to the board. But I would also say if they're on a right-of-way and the impacts from the adjoining right-of-way, we should be looking at ways to solve that problem and adjoining that business as well. It may not be through urban renewal, it may be through some other funding source that we have out there.
And I just want to share with my colleague, Commissioner West, that this is not an effort to withdraw that. It's more lines, trying to get a policy in front of it that does allow us to do this, but have a policy so that there's not the Me Too's coming along. So I agree with Commissioner Schrader. I agree with Commissioner Scholl's concern. I agree with your commitment. I just thought that having a policy that is pretty rock solid would be the wise move, and have it ran through a discussion to make sure legal counsel says that's as good as you're going to get it. I'm okay with that, but I'm not here to obfuscate or obstruct your effort.
Can I respond?
Yeah, go ahead.
Commissioner Savas, I appreciate that, and maybe we can still put a policy forward. I think we're on stable ground here. I don't want the endeavor for the perfect to be the enemy of the good. I think this is a good effort we're making, and maybe going forward, we maybe want to look at a policy. Maybe that's a different motion or direction that the board wants to do. I would support looking into that. But today, I think that this is the right thing. I think there's a lot of unique things in this specific situation. And I also think it's just, in my gut, I just think it's the right thing to do. So I do hear you, but maybe there's a way to continue forward also with the policy later or sometime soon.
Yeah, and just take this other last comment. There's one other point that Commissioner Schrader made I want to just capitalize on. Over the years, sitting on this dais, we've had, one of us get emotionally involved in such a way that we want to help someone, right? And, for the board, for one of us to say, geez, there's a nonprofit that's before us and they need X amount of money, and then we verbally make let's do that, or let's make a motion. That commits all of us, and then we either going to dig out or modify or tweak, and then you have a lot of people that come right after that. So, I think that in the future, let's be mindful that if we got a great idea, let's give us time to work on the details as opposed to just making the motion to just go ahead and do something and give it the full thought. So in the future, I think that was the other, Commissioner Schrader's other point.
I appreciate the feedback.
Yeah, it's just feedback too. It's not trying to.
Okay, Commissioners, we need to convene as a development agency for this vote. I will recess as a Board of County Commissioners and convene as a development agency. Commissioner West, would you repeat the motion?
I move that this board fund up to $50,000 to Conveco Manufacturing for through urban renewal funding for the improvements of landscape fencing, gates, and other street improvements. I hope I said that correctly. Moving in the near future.
I'll accept a second.
I'll second it.
Second it.
You second it, let Commissioner Scholl second.
Okay, Commissioner West has moved that we fund up to $50,000 to Conveco for the construction of the gate and fencing around their property with urban renewal funding, and Commissioner Scholl has seconded the motion. Any further discussion? Would the clerk please take the poll?
Director Savas.
I abstain.
Director Schrader.
Abstain.
Director Scholl.
Aye.
Director West.
Aye.
Chair Smith.
Aye, motion passes 3-0. I will now recess as a development agency and convene as a Board of County Commissioners. Commissioners, we have 2 more items on the agenda. I would like to recess promptly at noon because we need to reconvene at 1 p.m. to finish the rest of the commissioners' work. So we have 20 minutes, Gary, to finish the items. You're
Thank you.
up.
Next, administrative warrants for RV's code update. County Council Jane Veto has a question to ask.
Commissioners, on Thursday, you will hold a public hearing on whether to amend County Ordinance Chapter 7.01 and 2.07 to authorize the Sheriff's Office to request administrative warrants to tow RVs who are parked in county right-of-way. My question for you today is, would you like that ordinance to be adopted by emergency procedure? If you do that, it has to be a unanimous vote of the board to adopt by emergency procedure. If you do that, the ordinance will take effect immediately. If you do not authorize the emergency procedure, then if adopted, the ordinance will take place 90 days after the second reading.
So we have taken action on another issue that one commissioner particularly raised the question about. My opinion is, commissioners, if we could get to a unanimous vote on Thursday to adopt this as an emergency, it would go into effect prior to the other action that we voted on this week, correct?
That was an order. The gates was an order, so that took effect. I think the discussion we had was, realistically, would the sheriff's office need this enforcement action, this ability to request administrative warrants immediately and the action, or within the next week? And the thought was they could wait a little bit. Pushing it out 90-plus days might be more than the board wants.
Commissioner Savas?
Yeah, I think 90 days, you're right, 90 days is far more than I think that we were imagining at the time. So I would strongly support implementing the emergency aspect of it. And hopefully my colleagues will also support that for reasons obvious. The timing issue is incredibly important here.
It is. Thank you for that, Commissioner Savas. Commissioner Scholl?
Yes, I support the emergency aspect of this.
Thank you. Jane, we'll vote on that during the business meeting?
Yes.
Okay. But please bring that language forward for us to consider.
We will.
Chair, I have to run. I didn't know that
ahead.
we'd go this late, but
Yeah, I know. I didn't think so either. Gary, what's your recommendation for the rest? You're excused. Thank you.
If we could do the ABC appointment, please.
Go ahead, Tony.
Mental Health and Addiction Council Staff Behavioral Health currently has 6 openings on the commission due to vacancies and term expirations. Through a recruitment process, 6 applications were received and 6 are recommended for appointment. 4 are new, 2 would be reappointments. Through the recommendations are Teresa Melville to a 5th term, Pamela Pierce to a 3rd term, Beto Contreras to a 1st term, Dave Hunt to a 1st term, Ashley Cross to a 1st term, and Sarah Schindelbeck to a 1st term.
Thank you. Commissioner West?
I would like to be able to one to make this motion. I know many of these individuals. I'm the liaison to this group, and I'm super proud of the work that they've been doing, and they have been great. They are really an asset to this community. So if you don't mind, Chair, I'd like to make a motion.
Go ahead.
I move that we approve the appointment to the Mental Health and Addiction Council, which is staffed by Behavioral Health Division, the following recommendations of Teresa Melville to her 5th term, Pam Pierce to her 3rd term, Beto Contreras to his 1st term, David Hunt to his 1st term, Ashley Cross to her 1st term, and Sarah Sendelbeck to her 1st term.
I'll second that.
Commissioner West has moved the appointment, Mental Health Addictions Council, of the list that he just said. I'm not going to repeat it. And Commissioner Schrader has seconded the motion. Any further discussions? Excuse me. Would the clerk please take the poll?
Commissioner Scholl.
Aye.
Commissioner Schrader.
Aye.
Commissioner West.
Aye.
Chair Smith.
I will abstain for this. I'm in objection to one particular individual on this that I think is unseemly. With that in mind, the motion passes 3-1-0. Next, please.
All you have is commissioner communications that you could bypass or do that in the next 10 minutes, up to you.
Commissioners, do you want to talk more? Commissioner Scholl.
I got a real quick something for you. 2 things. I'd like to mention something about the Association of ONC Counties' efforts to get language in the Farm Bill that would, if passed, would provide for the reissue of the Secure Rural Schools Act. So they're working on that with the Senate and House Interior Appropriations Committee, And I'm hoping when it comes to a vote in the Congress, we're going to see some good things, because that Farm Bill is loaded with lots of things for many constituencies. So it's a must-pass piece of legislation. The other thing I want to mention real quickly is some good news. You might recall, gosh, going back to last fall, I toured some property up at Zigzag owned by the Forest Service. We talked about, with the supervisor of the Mount Hood National Forest, a concept for workforce housing. And the Department of Agriculture has approved it, the funding. And so now our supervisor of Mount Hood National Forest is looking at working with a civil engineering firm called Harper, Half, Peterson, and Regalius. And they've got a milestones, concept design September 2024, agreement signed November 2024, construction documents September 2025, and then construction start December of next year. So this could be a wonderful project for workforce housing. Is much needed up in the Zigzag area.
Yeah.
Long-term apartments, short-term apartments, bunkhouse idea for fire crews, firefighters, and RV parking for other folks that work for part of the year in the Forest Service. So that's really great. Thank you to Meadow Lofsgarten for their work on that. That's all I have.
Thank you for that report on the workforce housing and forestry. It brings a lot of questions to my mind.
Yeah.
How about approvals, land use in a forestry zone, the funding? Are we on the hook line for anything, Commissioner Scholl?
No, not right now. And of course, that's land that's owned by the Forest Service up there in Zigzag.
I don't know that it matters, but it's federal government. I don't know, maybe somebody can
Yeah, right.
give us a comment on that.
You may recall they came to you asking your permission to assist. We still have to bring that back to you, Commissioner.
Right, right. Thank you very much. Any other commissioners'
Well,
communications?
just bravo the workforce housing, I have to say, thank you. Commissioner Shaw, I just want to give my colleagues a heads up that I'm going to be getting information to you about the workforce board. They have come up with their strategic plan, and they have the budget. The chief elected official, that would be you, Chair Smith, needs to sign that, and I'm trying to try and get you to that information ahead of time. Should you have any questions before the workforce folks come and present this information to you. It's had about 4 or 5 different eyes on it. Their executive board, their board, their staffing, and, to me, it looks solid. I was going to ask Gary if I could have finance just take a look at it, just so if there is anything that raises a question, that we get that taken care of ahead of time. So that's just an update that it's going to be coming your way.
And county council as well.
Yes.
Thank you very much.
It's a busy day, so I will refrain from additional comments at this time. I thank you for that update. That's really valuable information, Commissioner Scholl.
It
As
is.
we're paying attention closer and closer to what's going on with our ONC lands and the SRS funding and all of that. I'm very curious about where our senators are out on that legislation and if we're still getting the support, at least from Ron Wyden, on that essential funding. We don't want to be a welfare county, but at the same time, we need to be able to try to keep our counties afloat until we actually find maybe a more permanent solution that gives them the dignity of hard work and industry within their communities. And Commissioner Scholl, you've been great on those issues, and we appreciate it. I will leave my comments at that as we move into lunch, but thank you. It's a busy day, Chair. It's a busy day.
And we have a busy afternoon. We will convene at 1 and recess promptly at 2 p.m. because I have a 2 p.m. meeting that's been requested of me. So, Commissioners, if we can keep our comments brief in the afternoon, if not, I'll have to pass the gavel. So we will recess and reconvene at 1 p.m. Thank you.